Katja, for the introduction, and a very good morning and afternoon for everybody who has dialed in. Today, I'll start by giving you a first introduction to Delft Imaging as an organization before we dive into talking more about BabyChecker specifically. You can go to the next slide, please. Yeah, perfect. Yes, perfect. One more. So to give you a little bit of a background of where we come from as an organization, for those of you that might not be that familiar with us yet, our organization actually goes back to the beginning of the early 20th century, where we were always involved in X-ray imaging and specifically specialized in tuberculosis screening. And this is something that we did with analog X-ray and then with these little mobile clinics. You can see our brand name here on the side. And over the years, actually, our technology has evolved to digital X-ray and also working with artificial intelligence rather than with human readers. But our approach has remained the same. And when we supported TB screening actually in the 70s of the previous century across Europe, and then when we eradicated it largely across Europe, we moved to those countries where TB is still a burden today. And that brings us to many countries around the world, especially in LMIC settings. So I just want to give you a little bit of an idea where we come from with the specialism in tuberculosis screening, also leveraging tools like AI, and how later that expanded into the work we're doing with BabyChecker today. Next slide, please. So I think important to note from our side, so Delft Imaging is a social enterprise, which means that we are a private organization, but we're very much focused on making an impact first. So one of the things in our approach is that we always try to see, okay, what is the problem specifically in a healthcare setting in which we really can make a difference? And then we trust that we are creative enough to ensure that there's a way to make that profitable and thereby also sustainable over time. So we're also a part of the Million Lives Collective, which recognizes innovations that have impacted more than 1 million lives around the world, part of the United Nations Global Compact, and also certified B Corp for the past 4 to 5 years. So one of the things we always do as an organization is that every year we bring out an annual impact report in which people can also transparently read more about how we've performed that year, things we've been working on, and that is both on the BabyChecker side as well as on our different solutions that we have. Next slide, please. So our presence, and actually coming back to also what we do with tuberculosis screening, also the work we do with BabyChecker, has brought our activities to more than 85 countries around the world, which you see visualized here. And as you can see, those are largely and almost solely LMIC settings, so low middle income countries. And this really comes out of that focus being focused on TB and also on the detection of risky pregnancies in low resource settings. Here in orange, you can see our own offices, like our headquarters in the Netherlands, where we are based today, our office in Ghana, Nigeria, and Indonesia. And you have a bit of an idea of the activities or places where we are active. As you can see, we virtually don't run any projects in Europe, even though our headquarters is in the Netherlands or in the US, because we really specialize in those health problems that are present in the global south. So over the years, we've been able to impact the lives of more than 30 million people around the world with our different solutions, using both imaging on the hardware side, like X-ray and ultrasound, and also using AI. Next slide, please. So one of the things I wanted to mention, and before we really dive into BabyChecker, I think this gives you a bit of an idea of our approach to how we work, is that we really try to be a one-stop solution for the health problems that we aim to tackle. So we really try to bring hardware, so the imaging side, so it could be digital X-rays, like we see here an example of what we do on TB screening and mobile clinics, but could also be with ultrasound, for example, with the software, like the CAT software for TB, but also with using BabyChecker. And we combine that with training and e-learning and various means of capacity building and also with after sales and service, so that can be holistically a partner for those organizations that are implementing these projects around the world and really provide all of the requested solutions A to Z. So the hardware, the software, all of the logistics around it, and also the capacity building and the service to ensure that things can be used sustainably. Next slide, please. Yeah, next slide. So, of course, we're talking really today about AI for the detection of risky pregnancies, but I did want to touch upon this quite briefly. So, one of the things we're doing a lot of work on in the TB sphere is actually really with portable digital X-rays. And I won't go all over the bullet points that are here, but one of the things that I find interesting is that what we've been able to do is using these portable backpack X-rays with the combination of AI. We have these X-ray systems that can go even into the most remote settings of a country and be able to take 400 X-ray images there. And they're quite portable. They weigh less than 30 kilos. So you can bring them on a keke, on a 4x4, even on a boat if you wanted to. And I think this combination of having both the hardware side that is very portable and on the CAD side, where we can support with, rather than having human readers, in every remote corner of the world, which wouldn't be feasible, we have CAD and AI to help out with the interpretation of, well, could be TB, but also, for example, of identification of risk factors during pregnancy. If you go to the next slide. Because this is what we've really been able to do on the TB side. So we're very most known for the CAT for TB software, actually, that we've developed over time. And this is actually something that started with research already in 1996. So there's a whole category that's today quite popular as AI for TB. It's actually something that was founded by us 20 years ago. And we started with projects already in 2007 on this, received the CE certification in 2015. And by 2018, we were already screening more than 1 million people per year using AI for TB specifically. 2021, because of all of that validation and projects that we had worked on, the World Health Organization endorsed AI for TB screening. And back then, we already had about 700 installations in nearly 60 countries. Today, it's one of the best performing algorithms available and active in more than 85 countries and has screened more than 30 million people and has been featured in more than 100 publications. So the way that it works is that it gives you a score between 0 and 100, indicating the extent of TB, as well as a color-coded heat map to show where those abnormalities are located. And I wanted to highlight these examples specifically because what we're doing, and I'll talk a little bit more about that in a second, is that like what we're doing on BabyChecker, again, we're combining both the hardware and the CAT AI software to be able to tackle these health problems in even the most remote corners of the world. Next slide, please. Yeah, so if you look at these, if you click, so just various examples of the software being used around the world. And we've actually had now a similar trajectory, and the team will talk about more about what we've been doing, of course, with BabyChecker, but starting with research, being able to roll out initial projects with partners, scaling up both in validation and in projects to really now where it's a solution that's been scaling up quite rapidly across the world and really having a real life clinical impact in those areas where it's needed the most. Next slide, please. One of the things I also briefly wanted to mention is that we're doing a lot of research currently also using ultrasound and AI for lung health. And this is actually something that we build upon the experience that we have with BabyChecker, using both a handheld ultrasound and on top of that, an AI to help control the sweeps that people have to make. And then working with artificial intelligence to basically identify potential abnormalities in the lung. So there's actually a new area of research after BabyChecker that leverages experience that we've used in that field, that we're actually now doing a lot of research in and that we see as an interesting area towards the future. Next slide, please. Yeah, of course, the team will talk about this much more, but I just wanted to give this as a bit of an introduction to how we work as a company. So We've built a lot of this experience in tuberculosis screening around the world, and then moved from AI for TB to AI for pregnancy-related risks. And that is because we saw that every day more than 800 women die from preventable pregnancy-related causes. The majority of these, the far majority, are in low and middle income countries. And from the way that we approach it is that we believe that a problem that is this extensively present in LMIC settings really requires a solution that's designed and developed for LMIC settings, taking into account infrastructural context, taking into account all of the opportunities and the challenges that LMIC have to deal with on a daily basis. So rather than taking, an ultrasound solution that we would have in a hospital here, really developing and implementing a solution that really is designed for those places that face most of this health burden. And that is how we came up eventually based on this problem with BabyChecker. So it's an artificial intelligence solution that analyzes obstetric ultrasounds to identify potential risks during pregnancy. So again, really a turnkey solution that's tailored to local settings and challenges. Turnkey meaning that, like what we do on TB, combining both the hardware, the software, being able to do the capacity building in person or remote, and also the required after sales support to ensure that these projects can run continuously for many years to come. So what we're really been doing is to bring Delft's expertise and experience as a total solution provider in this sphere, working on both the hardware side, like the low-cost ultrasound in this case, providing the phone with the app on it, as well as the AI software, and combining capacity building and service all under one roof. And we're really bringing that experience that we have on TB with all of those partners across the world, and leveraging that now into this new, relatively new area of AI for pregnancy-related risks. So I just wanted to give that as a short introduction to how we work as an organization, where we're coming from, and the experience that we've built in TB and that we're bringing into this space. I hope that you find the rest of the webinars and our speakers useful today, and that it gives you some useful insight. Thank you, everyone.
Thanks, Florent. As he pointed out, equitable health is the cornerstone of all our innovations here at Delft.